A freelancer drank 12 bowls of raw licorice root tea every day for 2 weeks. This is what happened to his heart. Presenting with sudden muscle paralysis and a blood pressure of 190/110, the 34-year-old male was rushed to emergency care. LM is a 34-year-old male presenting to the emergency department with ascending muscle weakness so severe he is unable to stand. At the bedside, the clinical team at Anatomy of a Mistake notes a dangerously elevated blood pressure of 190/110 millimeters of mercury. This is a hypertensive crisis, a state where the force of blood against artery walls is high enough to cause immediate organ damage. LM has no history of heart disease. He was a healthy professional until 48 hours ago when a strange twitch in his calves evolved into total physical collapse. Inside the stabilization bay, LM's heart is struggling to maintain a steady rhythm. The bedside monitor reveals ST segment depression, a sagging of the heart's electrical wave that signals the cardiac muscle is starved for oxygen. Even more concerning is a dangerously prolonged QT interval, meaning his heart is taking far too long to recharge between beats. When the lab results flash onto the screen, the medical team finds a critical potassium level of 1.8 millimoles per liter. To put that in perspective, a normal range is 3.5 to 5.0. LM has lost nearly 2/3 of the essential spark plugs that allow his muscles and heart to fire. The team suspects a metabolic alkalosis, from the Greek meta, meaning change, and alkali, referring to a high pH state. This means his blood has become abnormally basic as his kidneys aggressively dump acid and potassium into his urine. Doctors urgently question LM about his habits while he gasps for air, his diaphragm weakening under the strain. They consider hypertension, from hyper meaning over, and tension, referring to pressure, yet the source of this electrolyte theft remains a mystery. The diagnostic breakthrough occurs when LM reveals a specific change to his routine. For the past 14 days, he had replaced water with 12 bowls of raw licorice root tea to maintain focus. This chronic intake introduced large quantities of glycyrrhizic acid into his system, a compound known to inhibit the enzyme 11-beta-hydroxysteroid dehydrogenase type 2, which normally protects the kidneys from cortisol. This revelation shifts the investigation toward glycyrrhizic acid, the primary active compound in the root. The World Health Organization sets a safe limit of just 100 milligrams of this compound per day, yet LM was likely consuming 10 times that amount. To understand the damage, we must look at the enzyme 11-beta-hydroxysteroid dehydrogenase type 2. Think of this enzyme as a vigilant doorkeeper for the mineralocorticoid receptor, from mineral, referring to salts, and corticoid, relating to the adrenal cortex. Normally, this doorkeeper prevents a massive crowd of cortisol molecules from entering the receptor's VIP room, allowing only the hormone aldosterone inside. However, glycyrrhizic acid acts as a molecular saboteur, knocking the doorkeeper unconscious. Without this protection, the receptor is flooded by cortisol, triggering a systemic malfunction that mimics a state of extreme hormonal excess. By day 2, his labs show suppressed renin and aldosterone levels, the very hormones that usually drive high blood pressure. Yet his body is behaving as if they are 1,000 times too high. This is pseudohyperaldosteronism. From pseudo, meaning false, hyper meaning over, and adrenal, referring to the glands near the kidneys. In the renal tubules, the lack of a functional enzyme doorkeeper creates a massive sodium-potassium imbalance. We see a visceral cellular theft. Sodium is violently sucked back into the bloodstream, followed by water, which bloats the vascular volume and spikes his pressure. Simultaneously, potassium is flushed into the urine like a broken levee. To stabilize LM, the medical team initiates aggressive potassium repletion through a central line, as his levels are low enough to trigger a fatal arrhythmia. They also administer spironolactone, a mineralocorticoid receptor antagonist, from mineral, relating to salts, and antagonist, meaning a substance that stops an action. This medication acts as a molecular shield, physically blocking the flooded receptors from the cortisol surge. While the tea is gone, the inhibited enzyme requires 2 to 3 weeks to fully regenerate. LM spends 14 days in the hospital, slowly regaining the ability to walk as his blood pressure finally descends from the danger zone. We can conclude that even natural supplements carry potent pharmacological risks when the dose exceeds the body's metabolic capacity. Thank you for watching this episode of Anatomy of a Mistake. If this clinical breakdown of licorice toxicity helped you understand the delicate balance of your electrolytes, please like the video. Share your thoughts or questions in the comments, and subscribe for more medical deep dives. These stories are educational composites inspired by cases clinicians may encounter. They are not a substitute for professional medical advice.